Hello friends, Mike Fina here with the Union Labor Advisory Network. At the ULA Network, we're committed to spotlighting the individuals and organizations helping to reshape the future of healthcare for union members, working families, and the communities we serve. Today, we're honored to welcome Tim Weed, Vice President of Client Sales and Partnerships at Teladoc Health, a global leader in virtual care. Tim brings a wealth of experience in client success, strategic partnerships, and labor-focused healthcare solutions. At Teladoc, he leads the Labor and Union Division, where he drives innovative strategies that expand access to quality care, including telemedicine, mental health, chronic disease support, and preventative care programs for America's union workforce. A U.S. Army veteran and accomplished healthcare executive, Tim's career has been defined by a passion for service, strategic growth, and delivering impactful solutions to organizations that represent hardworking people across the country. We're excited to learn more about how Tim and the Teladoc labor team are partnering with unions to deliver smarter, more equitable healthcare solutions, and what the future of virtual care looks like for our union communities. Let's dive in. Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to be with Tim Weed, Vice President of Client Sales for Teladoc Health here in New York City, with us today to learn a little bit more about his background, history, experience, and how Teladoc Health is helping the union labor space today. So, Tim,
Awesome.
Thank you so much for being with us.
Absolutely.
Appreciate your time.
Yeah, thank
and
you.
I'm really excited to be at the new location in New York City.
Yeah, this is incredible. Just opened last week, so
That's
I'm excited
awesome.
to be here as well.
Exactly. I'm sure we'll get some little tour of the facility
Yeah,
as well.
absolutely.
So, Tim, could you give us, for the audience, can you give us a little history about yourself, your background, and how you got with Teladoc?
Yeah, absolutely. So I've been with Teladoc for about the last year now. I've been in healthcare for a little over the last decade. Prior to that, actually spent some time in the manufacturing industry, both in electrical manufacturing, automotive manufacturing. Prior to that, kicked off my career in the military. So healthcare is something that's very passionate to me. Took it for granted, to be quite frank, in the military. It was there, it's available. Unfortunately, there when you didn't want to use it, but you needed it.
Yeah.
But transitioning out of the military into the civilian sector, whether it be in the manufacturing environment, just working with folks out there on the line, to sitting at a desk all day. Really doesn't matter where you are. Healthcare seems to just be forgotten in our day-to-day. Wake up, work. Healthcare falls down that list of priorities. And something that's really passionate to me is just, and really what our mission here at Teladoc is, it's quite simple. It's helping people live their healthiest life. All people, everywhere, having that access to high quality care. And so that's what really brought me here to Teladoc. Is virtual care, I believe, it's no longer transformative of the future. It really is the foundation of healthcare today. And what we're doing here at Teladoc, I believe, is doing exactly that. Rather than making members work for their benefits, it should be the other way around. Their benefits should be working for them. It should be simple, should be accessible, should be convenient, and I believe that's exactly what we're doing here at Teladoc.
That's incredible. That's great. And for the audience as well, could you maybe give us a little bit more about what Teladoc Health is? I know in the labor space you work with quite a few different union organizations as well.
Yeah.
We want to get that word out and make sure people are aware of what Teladoc's doing today.
Yeah. So Teladoc has been around for a little over 20 years now, 23 years, and has transformed quite a bit over the years. Most folks may know Teladoc for their 24/7 acute care. Most folks may also know the name Livongo, their chronic condition management, whether it be diabetes, hypertension, prediabetes, or weight management. Teladoc today is all of that. Beyond just 24/7 acute care, our chronic condition support, we can't seem to make it a day without talking about GLP-1s, or even an hour within the day about talking about GLP-1s. So our weight management solutions, and all of these solutions and programs have embedded mental health support. We also have mental health support that's standalone, critically important, but we're looking at the entire spectrum of an individual's health, knowing that if you're dealing with diabetes, or you're looking to manage your weight, mental health is a critical element of that. And these what can potentially be bifurcated, separate, disparate solutions, we want to bring those all into one location. So rather than, just like your phone today, you pull up in your phone and you could practically do everything you need to do in your life on that phone. Healthcare, why does that need to be any different? Why are you needing to think about, brick and mortar over here for this, and provider benefit over here for that. Teladoc being able to pull open the app and be able to access all those in one location is pretty incredible.
Yeah, and the world of COVID, how that transformed a lot of lives as well, where people could not get out and you're working virtually.
No longer do you need to go find care or access. You shouldn't need to be able to go search for that. You should just be able to pull up on your phone and be able to get that access to care. Acute care, sinus infection. I've got a sinus infection, or I'm dealing with potentially the flu at work. Do I need to now take off a half day? Do I need to stress about trying to get on the road early and calling my doctor? Or can I just go sit in my vehicle or find a quiet corner of the facility, pull open my phone, and 15 minutes later have a prescription waiting for me? So that's really the difference of what Teladoc's doing today. Being able to combine all these programs in one integrated app. Integrated key. It's one thing you go to see a specialist or provider, your PCP, and you're hoping they can access the information or talk to each other. Whereas with Teladoc and that one app, whether you're seeing an acute provider for an acute need, or your ongoing PCP, or talking to a health coach about managing your weight, we're able to see all that information in one location and be able to manage your entire health. So I think it's incredible what we're doing, and I leverage it myself all the time. I've been on the road. How long would it take you to go see a dermatologist today if you needed to?
Exactly.
Probably 6 months. Yeah. Last time I was on the road, I had an issue I was dealing with. I was literally in the Uber. I pulled open the app. Got into the dermatologist appointment, got into my hotel room, snapped a few photos. Within 15 minutes, I was texting my wife, asking her if she can go pick up my prescription so it'd be ready when I got home. So pretty incredible what we're doing today.
Yeah, and Tim, maybe you could elaborate a little bit on some of the preventative maintenance as well with some of the telehealth services as well, because again, when we look at benefit funds, how do you drive down costs but provide better service to the membership? And in the union labor space too, that's one of the biggest challenges, finding better services for more cost-effective, with a more cost-effective solution, and technology's allowed us to do that today.
Yeah. Proactive versus being reactive. Everything in life, whether it's maintenance on your home or your vehicle, you wait for it to break, and it's probably going to cost a lot more and result in a lot more inconvenience. Health is no different. So virtual primary care, virtual at-home wellness checks. So a lot of ways that Teladoc can support members in the preventative, proactive ways of managing their health. So earlier this year, we announced an acquisition, Catapult Health, first provider of virtual at-home wellness checks. Literally looks like a shoebox, comes in the mail, can do labs in the comfort of your own home. Literally, when I did it, I always tell folks when I'm explaining the program, it's one of those programs you need to read the instructions, because you place this device on your arm and it does a blood draw for you. You literally don't feel it. And so it's incredible. Throw it back in the mail, prepackaged envelope back in the mail. A couple days later, the results are ready, being connected to a nurse practitioner, and be able to go through your results. So that's a very easy and clear example of ways that unions and groups and members can be able to proactively, preventatively manage their healthcare. Beyond that wellness check, then we're able to connect them directly into their programs. What we found is roughly 26% across our entire book of business, roughly 26% of our members that are engaging with our virtual primary care previously never had a PCP. I fall in that category.
Wow.
And so that's roughly 1 in 4 folks never had a PCP. We're getting them connected to PCP, and this isn't just a once a year check the box. You're waiting in the waiting room for 2 hours for a 20-minute, shuffling the cattle through type experience. These are typically on average about 40-minute provider sessions. And then, of course, you leave your PCP's office, and next thing you know, you've got a question an hour later. What do you do?
Yep.
Who do you call? Well, we've got 24 access to coaches, care team, being able to ask those questions. Wake up in the middle of the night. Oh my goodness, I've worried about something, I'm going to ask my coach. And
Yep.
so being able to have that 24/7 access, again, just goes back into that preventative, proactive way of managing your health before these costs are rising and spiraling out of control. Whether just GLP-1s and access to care continues to be an issue, and just the overall general rising cost of health. It's not getting cheaper as the years go on, and so for unions and members to be able to manage that in a way that's cost effective, that's efficient, that's convenient, and provides that continuity of care, so I can continue to go back even in a virtual setting and be able to talk to the same PCP or be able to continue to engage with the same coach and care team. It's been a very unique experience for me to be able to leverage these own assets for myself.
Oh, and Tim, and for the audience too, I did go through the catapult testing. It was easy. I was a little, apprehensive at first. I didn't know, but like you said, when you were taking the blood, you put that right on your arm, and you just hit just push down. It was so easy, simple.
Yeah.
We packed it up into UPS packing slips, and then shipped it out, and it came back, and it was phenomenal. So
when you think about groups and unions and members spread across time zones, spread across job sites, facilities, shift work, the reality is, we need to be able to meet the member where they're at when they need the help, and that's what we're doing here at Teladoc. So thinking about bringing in assets like Catapult Health and being able to then integrate that into one, expansive, comprehensive solution, from a preventative wellness check to ongoing, maintenance and continued preventative care, as well as having that, that reactive something's going on. I don't feel right today. I need to talk to a doctor. Being able to have that all in, at your fingertips.
Yeah, and Tim, obviously, when we talk about all these particular benefits, right?
Yes.
We look at all these are value-added services to the members that you're providing to the healthcare funds, and then when they look at everything, you look at costs as well.
Yes.
And I guess, when you look at the data and statistical information that's out there as well, maybe you could elaborate on some of the cost savings, some of the statistical information that's out there that's really, you're getting some better service for more cost-effective pricing for those funds. So it's almost like a double benefit, triple benefit really, for the member, for the funds, for the organizations, and then the accessibility.
Yeah, absolutely. Yeah. Across our primary virtual care program, we see across our entire book of business about a 10% reduction in medical costs for those members being able to engage. We see a pretty significant reduction in emergent. There's $32 billion a year is spent on unnecessary or avoidable urgent care costs. When you think about it, you work all day, you've got an issue going on, your PCP, your doctor's office closed, or they can't see you for a week. Where do you go? You go to urgent care. You're spending unnecessary urgent and emergent care funds when you could literally pull up on your phone and be able to connect to a provider within a matter of minutes. What does that $32 billion in avoidable urgent care costs translate to in working hours? 200 million working hours a year. So when you think about unions and groups being able to support their members and have benefits that actually provide true tangible benefits to the member, not only just keeping them healthy, but giving them that time back, not just for work, but also for their family too. Now they're leaving work and they're not going home to their family because they're trying to get into a brick and mortar provider. They've got that time back with their family as well too. So.
That's right. And Tim, I know we talked about a few different hot topics that are going on today.
There's
a few. You mentioned before too, GLP-1s,
Yes.
The emergence of that and how people are utilizing those particular services and how those are not cheap, services to have, and how that's affecting some of the benefit funds on the Taft-Hartley side. Maybe you could elaborate a little bit more about the services you're providing with GLP-1s or how that's working within Teladoc.
Yeah. So GLP-1s is continue to be a hot rising topic, and I think it's really getting to the point that funds and groups, employers, where they can't avoid the issue. We've got to be able to talk about it. And whether or not funds are going to cover GLP-1s for obesity or weight management or not, members need support when it comes to those GLP-1s. it's about 40, somewhere between 40 and 43% of the U.S. adult population suffers from obesity today. So here at Teladoc, we've got a pretty comprehensive weight management program. We've got some very base elements of our core weight management program that provides coaching, food logging, digital assets to be able to help members create those behavior and lifestyle changes that can be proactive and can continue with that member as they continue through their journey, as maybe they're trying to lose 5 pounds for a wedding coming up. Now, as that transcends into a more comprehensive weight management program where we're thinking about GLP-1 support, providers, prescribing, we have a very comprehensive program, our comprehensive weight management program, that we can provide GLP-1 content or access to GLP-1s, prescribing. If funds or groups don't want to or don't cover GLP-1s today, we actually have a self-pay program where we can provide all of that coaching support for members taking GLP-1s or looking at taking GLP-1s. We're only going to prescribe when it's clinically appropriate, following FDA guidelines. We're not incented in any way for one drug or prescribing versus not. We're really here to do what's right for the member and help them in that journey. But as mentioned, self-pay. So GLP-1s are expensive. Many groups don't cover it today. Some do. Some are actually looking to get away from it because the costs have just risen to the point that it's unattainable. And so we've got our programs today, whether a group is covering GLP-1s and want to tighten the controls around that or just make sure that it's appropriate access. Folks aren't going to a med spa and getting a GLP-1.
Right.
We see that statistics will show, and even the FDA will say that when it comes to GLP-1s, they're most effective when they have lifestyle and behavior modification that supports that. So when you're thinking about healthy eating, healthy sleep, exercise, those are the things that are going to help the GLP-1s be most effective. And eventually, and hopefully as members are able to titrate off of that, having that lifestyle management and support is what's going to be most key to make sure that they don't gain that weight on the back end. So,
wow. Okay.
There's a lot there to
There's
unpack.
There's a lot. Tim, can you elaborate as well too? Obviously we were talking in the union labor space, so you're looking at the benefit and health funds. How do you work with the providers, the insurance providers? How does that work or integrate into Teladoc? Or do you work collaboratively, or how, from a integration standpoint with some of the benefit funds?
Yeah. So and when you say providers, are you meaning like the health plans or
the insurance carriers?
Yeah, the insurance carriers. Yeah. So absolutely, we integrate. We have relationships with most all insurance carriers that we integrate directly with. So that's one of the beauty of Teladoc is we're not a disparate bifurcated solution that sits over here on the side. We truly are thinking about all that data interoperability. When our providers are meeting with members, we're able to pull open their patient health history and be able to look for gaps in care. Maybe I'm talking to you. We'll call Dr. Tim. Don't go see Dr. Tim, but you're talking to one of our providers for one issue. We're able to see what other gaps in care, like screenings when it comes to cancer screenings, or you haven't had an annual wellness check in the last 3 years. Why haven't you had an annual wellness check? So we're able to look at those gaps in care as well. We're getting that data from our insurance carriers, from the providers, and making sure that when we are meeting with the member, we're able to provide them with the most comprehensive and fully integrated care possible.
That's great. And then for the health plans itself, when you talk about the benefit funds integrating in, how does it work for a benefit fund that's interested in working with Teladoc Health? How do they get involved, or how does the integration process work?
Yeah. So we've got a full team that manages that integration process, whether it's work. So a lot of funds will actually, because we have those partnerships, for example, whether it be with UHC, Optum, Aetna, Anthem, they can, or many of the Blues plans, they can be able to acquire Teladoc access directly through those plans, or they can work directly with us, and we'll make sure that we're integrating that data and getting that all of that implemented before we roll those programs out for their members.
Gotcha. Again, all today's technology driving down operational expenses, providing better care and services. So when you look at an organization like Teladoc Health, being, a premier provider of these particular solutions, and then being able to integrate a lot of these services as well, it just your life's in your hands.
Yes, it's in your hands.
It's in your hands, and I guess the accessibility or really working with organizations like yourself to communicate these services are available.
Yeah. I mean, unions have always done such an incredible job fighting for the benefits of their members. And members shouldn't have to go fight or navigate or struggle to figure out how to leverage and manage their own benefits. It should be the other way around. Those benefits should be there for them. And that's what we believe we are doing here at Teladoc. We are there for the member. We're in their hands. We're in their pockets. We're on their browser. But ultimately, at the end of the day, when they need us, we're there. And we're supporting them at the time that they need it, wherever they're at. Yeah, weight management, GLP-1 just continues to be a trend on the rise. And I mentioned we have our mental health integrated across all of our solutions. And cardiometabolic health is another hot topic and area. So historically, many folks may know the historic chronic condition management portion of Teladoc, historically Livongo. Whether it be our diabetes, our hypertension, prediabetes, we're taking a look at not those individual programs as standalone separate programs. We do offer those if a group's just looking for diabetes management as an example. We do offer that as a standalone. But really what we're looking at is the overall cardiometabolic health of a member and an individual. The American Heart Association has what they call their Essential 8, which includes sleep, physical activity, diet, and a few others. We have designed our program in a way that we're looking at those Essential 8. We actually added one, call it the necessary 9, if you will. We added in stress in as well, which is incredibly important. Stress surfaces
drives a lot, yeah.
in a multitude of different ways, and that's why we integrate our mental health programs within our program. So cardiometabolic health is another very hot topic right now, as we're thinking about not just, again, these bifurcated programs, but how are we looking at that member's overall cardiometabolic health, so we can support groups in a very simple way, providing these programs under a single price point, so they're not worried, again, when we're thinking about cost, not having to go out and have many different point solutions. Rather, again, a member is able to pull open their phone, access all these programs through one single location, one app, and be able to have that continuity across those providers.
Again, Tim, it's you sold me.
Yeah.
I'm ready to download the app and get the
yeah. And it's what's incredible is I use it all the time. I use it for myself. I use it. My spouse uses it. My kids use it. It's being able to sit there with your kid who's dealing with a sinus infection or whatever they may be dealing with, and being able to talk to a provider. Again, 200 million lost hours, working hours annually, $32 billion in avoidable urgent care costs. Those are the things that we can directly address and be able to address for members in a convenient way.
That's great. And when you sit down, those are the statistical data that's true, that's real.
Yeah.
And when you look at a potential plan, or you're going in to consult with another healthcare provider, or at a benefit fund, this is the information: better care, low cost,
yep,
better access, and the communications there for those particular members. So
absolutely,
you're going to get a happier member, happier benefit fund, and obviously, like you mentioned before, these union organizations fight every day, and the executive leadership looks to provide those benefits, quality care to those members, because they're working every day for America, for the communities that they live in as well. So you want them to have healthier lives.
And the reality is, those benefits can be great, but if they're not easy to access or easy to use or easy to navigate, they're not going to be utilized. And ultimately, at the end of the day, these unions are fighting for these benefits because they believe in them, and the members need them. And so we need to make sure that we are surfacing and providing these benefits and these programs in a way that's most convenient for members.
That's great. And for me, in the world of the ULA network, we talk about communication.
Yes.
And if you're looking at utilization, you need to make sure you're communicating with those members to make sure they have access.
Absolutely.
They may have it in their phone, but not even realize that these programs are there for their best interest.
Yep.
And for me as well, really understanding the healthcare's, and the benefits that you have when you don't have them.
Yeah.
Like you mentioned, as a veteran, and you have them, but then you leave and you realize what you don't have.
Absolutely. Yeah.
So, Tim, I just want to thank you for all that you've been doing. I'm proud to have you as a supporter and work alongside you, and to promote all the services that Teladoc is providing to the union labor space. Thank you.
Yeah, no, thank you. And it's incredible. I mean, the healthcare is a landscape that's going to continue to shift. It's like technology. You go back 30 years of what the computer looked like, and we were just talking about it as we were setting things up, right?
Yep.
just the equipment to record this is practically fits in your pocket. Healthcare now fits in your pocket, and that's something incredible for us to think about as we go into the future. You can bring your benefits with you. You can bring that care with you. You can bring that support with you. You can bring that assurance and that comfort. Just knowing that when you need help, when you need support, it's there and it's available.
That's great. Again, I just want to thank you for everything that you're doing. We're proud to work with you and want to make sure that we're getting this information out to the masses. And if there is people that are interested in learning more about you, how do they get in touch with Teladoc Health? Funds, organizations that are looking for opportunities to work with you.
Yeah, absolutely. I mean, just reach out. Maybe we can throw it up here on the screen. We'll throw up the information. But yeah, just give us a call. We're happy to work with you. So whether it's from mental health, preventative, proactive, at-home wellness checks to ongoing virtual primary care, to chronic condition support and weight management and GLP-1. So it's not just one solution. We're truly looking at an entire member's health and that continuum continuity of care. So yeah, reach out. We are here to support and happy to support. Roughly 302 million members we support today. 3 million of those are union members. 20 years. Teladoc isn't going anywhere.
It's just growing.
Just growing.
And you're utilizing technology and collaborating with other organizations and tech companies to really
Absolutely.
build these things out. So.
Yeah, and we didn't hit on that, but maybe real quick, one of the things that we are also doing is what we have is what we call our Connected Care Partner program as well. So I mentioned a number of solutions. We also partner with a few other organizations as well. Sword, Hinge, to name a couple. Oshi. We've got partnerships with those organizations that we can actually embed that within our app. So again, when we think about where do you go for health, Mike? You pull open your Teladoc app. That's where you go for help. And so to be able to have other connected care partners that you can leverage through that same application as well, that we can do some of that data interoperability and sharing with our providers. So if you're connecting with a Teladoc PCP, but you're also working with Hinge or Sword as an example on musculoskeletal, we're able to share that data back and forth. And again, you're able to access that all through one single location.
Data is everything.
Data is everything. Data interoperability. It's the cornerstone of healthcare. If you can't connect to the left hand to the right hand, the member's stuck doing that on their own, and that they shouldn't be the one that has to do that.
That's great. Well, again, Tim, thank you so much, and thank you for educating me on more of what Teladoc Health is offering to the union labor space as well. So, look out for more information on Teladoc Health. We're proud to have them as a sponsor. We look forward to supporting our union labor space. And again, Tim, thank you for what you do. And thank you for your service as a veteran as well.
Thank you. Awesome. Thanks, Mike.
All right. I'd like to thank Teladoc Health for all they do to help support union labor in our communities. For more information, contact teladochealth.com or reach out to Tim Weed, VP of Client Sales, or Charlie Gustafson, Regional Vice President for Labor. Thank you.